As a physical therapist, you are a master of movement, a true expert helping the human body heal and regain function. You see patients every day who are struggling with pain, weakness, a loss of independence. You design brilliant plans to get them stronger and more mobile. But have you ever had a patient who just doesn't progress? Someone whose fatigue seems overwhelming, whose muscles don't respond to strengthening, or whose healing is frustratingly slow? The answer might not be in their joints or muscles, but in their hormones. The endocrine system, a complex network of glands producing vital chemical messengers, is often the missing piece. Understanding this system is not just for endocrinologists, it is absolutely crucial for you. Hormones dictate our energy levels and mood, and our ability to build muscle and repair tissue. When this system is out of balance, it can directly undermine the work you do. An undiagnosed thyroid problem can leave a patient too exhausted to exercise. Poorly managed diabetes can cause nerve damage that makes balance training unsafe. Ignoring these conditions is like building on an unstable foundation. It's not just ineffective, it can be dangerous. Bringing basic endocrine awareness into daily practice is a game changer. Ask the right questions, spot the subtle warning signs, modify your treatment plans for maximum safety and effectiveness. You don't need to be an endocrine specialist. Become a skilled detective. Watch for diabetes, thyroid disorders, adrenal dysfunction. Recognizing them will elevate your practice, protect patients, and strengthen collaboration with the healthcare team. It turns good physical therapy into great physical therapy. Integrate a few simple screening questions and observations into your evaluations and follow-ups. You can uncover hidden barriers to recovery, tailor exercise prescriptions, educate patients on self-monitoring. Diabetes is one of the most common chronic conditions you will see in your clinic. At its core, it's a disease where the body struggles to manage blood glucose, or sugar. Type 1 diabetes, the body doesn't produce insulin. Type 2 diabetes, the body doesn't make enough insulin or can't use it well. Many patients arrive diagnosed. Others are undiagnosed or poorly managed. The effects go far beyond blood sugar readings. They directly impact the tissues you're trying to heal. The consequences for movement and rehab are profound. Peripheral neuropathy, nerve damage often starting in the feet, hands, numbness, tingling, burning pain. Neuropathy can diminish a person's ability to feel the ground beneath them. That dramatically increases fall risk. Balance and gait training become high stakes. High blood sugar can stiffen connective tissues. This causes conditions like adhesive capsulitis, frozen shoulder. Standard stretching and mobilization may need adjustment for safety and effectiveness. Diabetes impairs circulation, especially to the extremities. Reduced blood flow slows healing. Even micro-trauma from exercise can take much longer to repair. Wounds on the feet can fester into chronic ulcers. Risk of infection and amputation. These aren't isolated orthopedic issues. They may be systemic problems sabotaging progress. Treat the whole person, not just the symptom. Screening for diabetes-related risks can be seamlessly integrated into your standard evaluation. It begins with simple, targeted questions. Ask your patient if they have a history of diabetes. Ask how they manage it. Oral medications, insulin. When was their last meal? When did you last check your blood sugar? These questions provide a wealth of information about their current metabolic state. For patients without a diagnosis, ask about classic symptoms: unusual thirst, frequent urination, unexplained weight loss, persistent fatigue, tingling in the hands or feet, numbness in the hands or feet. Next, perform a quick but vital physical screen. Always, always, always check the feet. Have the patient remove shoes and socks at every initial evaluation if you suspect any risk. Look for redness, blisters, calluses, open sores. Check the color and temperature of the skin. Assess for a healthy pedal pulse. Test protective sensation using a monofilament. Loss of protective sensation means high risk for injury. Check vital signs, especially blood pressure. Many people with diabetes have hypertension, increasing cardiovascular risk. When it comes to exercise, safety is paramount. Avoid exercise if blood glucose is under 100 milligrams per deciliter without a snack. Avoid exercise if blood glucose is over 250 milligrams per deciliter with ketones. Avoid exercise if blood glucose is over 300 milligrams per deciliter without ketones. Hypoglycemia can cause dizziness, shakiness, confusion, and fainting during exercise. Always have a source of fast-acting sugar, like juice or glucose tabs, available in your clinic. Very high blood sugar can sometimes rise further with exercise, stressing the body. Moderate intensity aerobic exercise like walking is fantastic, paired with closely monitored strength and balance training. Knowing when to refer is the hallmark of a responsible clinician. Any new or non-healing wound on the foot requires immediate communication with the patient's doctor. Watch for infection signs: redness, swelling, warmth, pus. Reports of frequent or severe hypoglycemic episodes should prompt medication review. If a patient exhibits symptoms of uncontrolled diabetes, extreme fatigue, confusion, shortness of breath, stop therapy and contact their medical team. Your role is not to manage their diabetes, but to identify risks and ensure the medical team is aware. Section 4. The thyroid gland, your body's master regulator. The thyroid, a small butterfly-shaped gland in your neck, wields enormous power over the body's metabolism. It produces hormones that regulate heart rate, body temperature, how fast you burn calories. When this gland goes haywire, it creates two opposite but challenging clinical pictures for PTs. Hypothyroidism, an underactive thyroid. Everything slows down. Hyperthyroidism, an overactive thyroid. The body goes into overdrive. Both can masquerade as musculoskeletal problems and are easy to miss. Hypothyroid patients may have generalized muscle aches, weakness, deep, persistent fatigue. They may gain weight despite no diet change, feel cold all the time, have constipation. On exam, sluggish reflexes, muscle stiffness, even carpal tunnel from fluid retention. Hyperthyroid patients may seem agitated, anxious, restless. They may have unexplained weight loss, a racing heart, hand tremors, heat intolerance. They often have profound muscle weakness in shoulders and hips. This is proximal myopathy. Exercise is risky because resting heart rate is already high. Aerobic exertion can trigger arrhythmias or palpitations, straining the heart. They're also at higher risk for osteoporosis, increasing fracture risk. Assess. Ask about weight changes, energy levels, tolerance to hot or cold. Always check resting heart rate and blood pressure. Resting HR over 100 beats per minute is a red flag for hyperthyroidism. Look for visible hand tremor, skin changes, dry and coarse in hypothyroid, warm and moist in hyperthyroid. Exercise guidance. Hypothyroid. Start slow, progress gradually as meds improve energy. Hyperthyroid. Low impact, low intensity only. Monitor heart rate closely and avoid activities that risk exhaustion or cardiac events. Section 5. Adrenal Conditions. The stress, salt, and sugar connection. The adrenal glands sit atop your kidneys, tiny powerhouses and primary stress responders. They produce cortisol. Cortisol manages inflammation. Cortisol controls blood sugar. Cortisol regulates the sleep-wake cycle. They also produce aldosterone. Aldosterone regulates blood pressure. Aldosterone controls salt balance. When these glands malfunction, the effects can be systemic and severe. Two key conditions. Addison's disease. Addison's, the adrenals produce too little cortisol, and Cushing's syndrome. Cushing's, excess cortisol, often from long-term steroid use or a tumor. Both can impair a patient's ability to participate in physical therapy. Addison's often presents with extreme fatigue, muscle weakness, unexplained weight loss, and dizziness, especially when standing up. Orthostatic hypotension. They may report cravings for salty foods. For these patients, exercise can be perilous. Low blood pressure makes them prone to fainting. Pushing them too hard can trigger an adrenal crisis, life-threatening shock, and loss of consciousness. Cushing's presents a starkly different picture. Central obesity, weight gain around the trunk, a rounded moon face, a fatty hump between the shoulders. severe muscle wasting and weakness, especially in the legs and arms. Skin becomes thin and fragile, easy bruising, stretch marks. High cortisol leaches calcium from bone, leading to osteoporosis, very high risk of fractures. Even a simple fall or forceful therapeutic exercise could result in a broken bone. Screen by asking about unexplained weight changes, persistent fatigue, dizziness upon standing, and new skin changes like bruising or stretch marks. Always check blood pressure sitting and again 1 minute after standing to screen for orthostatic hypotension. For suspected Cushing's, protect fragile skin, be mindful of high fracture risk, avoid high impact and heavy resistance. For Addison's, progress must be extremely slow. Monitor for dizziness and fatigue. Allow for longer rest periods. Ensure they are well hydrated. Any sign of a sudden drop in blood pressure is a red flag. Stop therapy and refer immediately. Severe dizziness is also a red flag. Stop and refer immediately. Collaborate with the medical team to keep patients safe while you adapt care plans to their endocrine realities. Section 6. Universal precautions. A unified approach to endocrine screening. While diabetes, thyroid, and adrenal disorders have their own unique profiles, you can adopt universal screening habits that catch red flags for all. Think of this as adding an endocrine review of systems to your standard evaluation. It doesn't have to be long or complicated. It's about cultivating a mindset of curiosity that looks beyond the obvious musculoskeletal complaint and considers the whole person. This approach is built on trust, careful observation, and consistent monitoring of key indicators of systemic health. At every initial visit, ask about energy and fatigue, weight and mood changes, sleep patterns, temperature tolerance, and medications like steroids or hormones. Make vital signs non-negotiable, blood pressure and heart rate at rest for every evaluation, especially in older adults or those with fatigue or dizziness. For at-risk patients, check BP sitting and standing. That extra minute can be life-saving and provides a baseline to track change. Perform a quick skin screen. Overly dry, bruised, or thin. Any wounds, especially feet and lower legs, skin and appearance offer systemic clues. Poor healing suggests diabetes, easy bruising Cushing's, coarse dry skin hypothyroidism. Combine observations, history, and vitals to build a powerful clinical picture. Section 7. Conclusion. From awareness to action in your practice. We've covered a lot of ground, but the message is simple and powerful. You, as a physical therapist, are in a unique position to be the first line of defense in identifying endocrine red flags. Your long-term contact lets you notice what others might miss. Integrate key questions, make vitals routine, and interpret them. Resting HR over 100 or orthostatic drops are calls to action. Perform thorough skin and foot checks for at-risk patients. If you spot a red flag, document. Inform the patient, contact their provider, and collaborate. That's how you safeguard patients and elevate outcomes.